Hi, welcome to Nursing MANTHRA online crash course. COVID-19. COVID-19 and nursing. We will discuss regarding some of the pre-test questions related to the COVID-19. So, what is MERS? MERS is Middle East Respiratory Syndrome. Where it is started? It is started in Saudi Arabia in 2012, originated from camels. SARS, Severe Acute Respiratory Syndrome, started in China in 2003, originated from civet cats. It is look like say mongoose rather than the type of cat we can say in the US and more it is there. And COVID-19, all of us know that is coronavirus disease 2019 most current outbreak. It is started in Wuhan city, China in December 2019. Origin currently unknown. But there is a saying like a possible chances from seafood sources from an animal market in Wuhan city, China, or from a pangolin, that is a type of ant eater. So we can move through pre-test questions. Coronavirus COVID-19 questions. Question number 1. Which statement about the coronavirus is incorrect? A. Coronavirus is a term used to describe a large group of viruses that cause respiratory symptoms. MERS, SARS and COVID-19 are type of coronavirus. C. Coronavirus are rarely zoonotic in transmission. D. The coronavirus is contagious. So the answer, which is incorrect, they are asking. So in this, which one is incorrect? That is answer C. Coronavirus are rarely zoonotic in transmission. This means that they are spread from animals to humans. Once this happens, the virus can be spread from human to human. All the other statements are true about the coronavirus. Question number 2. When a virus is transmitted from an animal to a human, this is termed as A. Mammalian event, B. Zoonotic spillover event, C. Interspecies transmission event, D. Intraspecies spillover event. So the answer is B. A zoonotic spillover event is when a virus is transmitted from an animal carrying the virus to a human. This is rare but can happen, as we have seen with the coronavirus. So coronavirus, the virus which is transmitted from an animal to human, we are calling it as zoonotic spillover event. Zoonotic spillover event. Okay. Next question. Middle East Respiratory Syndrome, MERS, started in where? Okay. And was transmitted from dash to humans. A. China, civet cat. B. Asia, seafood. C. Saudi Arabia, camels. D. China, pangolin. The answer is C. MERS started in Saudi Arabia and was transmitted from camels to humans. 4. Severe Acute Respiratory Syndrome, SARS, started in which city and was transmitted from dash to humans? A. China, civet cat. B. China, pangolin. C. Saudi Arabia, camels. D. Asia, seafoods. The answer is A. China, civet cat. SARS started in China and was transmitted from civet cat to humans. Sixth question. COVID-19 is genetically similar to what other coronavirus, but it's actually a different virus? MERS, SARS. The answer is B. COVID-19 has been found to be genetically similar to SARS, but it is a different virus. Genetically, similarity is there with the SARS virus. Seventh question. What is the name of the virus that caused COVID-19? A. SARS-CoV-1, HCOV-CO4-3, and MERS coronavirus, SARS coronavirus 2. Answer is D. What is the name of the virus that caused COVID-19? SARS-CoV coronavirus 2. Severe acute respiratory syndrome coronavirus 2. COVID-19 is genetically similar to the SARS coronavirus, but it is a different virus. Question number 8. How is COVID-19 primarily spread to others? Through airborne, droplet, blood, or fecal oral? So answer is B, droplet. COVID-19 is primarily spread to others via respiratory droplets. However, it may spread via contact to the eyes, nose, or mouth, since the virus may be able to live on surface. More research is needed at this time to investigate other routes of transmission, like contact transmission. But we can say, if we are giving like this options, then we have to select the answer droplet. Okay. Other all routes also we can the contact transmissions also we can suspect. But anyway, contact transmission option is not here, so it's okay. Select the signs and symptoms of COVID-19. Fever, cough, sore throat, fatigue, shortness of breath. All the answers are signs and symptoms of COVID-19. So all of the above will be the answer. In the US, there is currently low risk of the development of COVID-19. At this time, what are some preventive measures the nurse can teach the members of the community on how to prevent acquiring COVID-19? Select all that apply. A. Hand washing. B. Wearing a face mask when going around others. C. Covering mouth and nose when sneezing and coughing. D. Avoiding others who are sick. E. Staying home when sick. So the answer is A, C, D and E. Option B is not currently recommended by the CDC in the US due to the low risk of COVID-19 at this time. One of the reasons is to prevent wasting face mask resources also. But in other countries, they are recommending the use of face mask in public spaces, and there will be fine also will be there. So according to each country, the rule will be changing. And you can check for the latest updates also in US also. Now, this is our presentation related to COVID-19. Introduction to COVID-19. As we all know that coronavirus was first identified as a cause of common cold in 1960. Until 2002, the virus was considered a relatively simple, non-fatal virus. Coronavirus disease 2019, COVID-19, is an infectious disease mainly of a respiratory system caused by SARS-CoV coronavirus 2. Started from Wuhan city of Hubei province, China. COVID-19 stands for Coronavirus Disease 2019. COVID-19 is caused by a new type of coronavirus that has not been seen in the human until now. The virus name is SARS coronavirus 2. Why it is called coronavirus? It receives its names from the way the virus looks. The virus has pointy projections that protrudes of it. The word corona in Latin means garland or crown. So how it is the name came means the word corona in Latin, it means garland or crown. Therefore, the pointy projections, you can see here projections. The pointy projections are similar to the projections of a crown. It is a crown like. So, the name it is called coronavirus. Is this virus is the same as the virus that caused SARS? According to the Center for Disease Control and Prevention (CDC) government, the virus is genetically similar to the SARS virus, but it is not the same virus. So you can see the structure of this virus, spike glycoproteins and M proteins. Later on we will discuss regarding that. Some changes are there between SARS virus. So coronavirus come from animals. Animals that are infected with coronavirus can transmit them to humans. Once the virus is transmitted to humans, humans can start spreading the virus to other humans. And this leads to an outbreak. When this happens, it is called a zoonotic spillover event, as we discussed in the pre-test. It is a zoonotic spillover event. On January 30th, 2020, WHO declared the 2019-20 coronavirus outbreak to be a public health emergency of international concern. COVID-19, named by WHO on February 11, 2020, and the virus was named as SARS coronavirus 2, belongs to the family of coronavirus. The name too, crown-like spikes on their surface. In March 2020, WHO declared COVID-19 outbreak as a pandemic. What is the etiology of COVID-19? Coronavirus tended to cause mild upper respiratory disease in humans. So, of the 7 known species of coronavirus, only 3 are known to cause severe infections in humans. So total 7 species are there in coronavirus. In this, only 3 are causing severe infections in human beings, all within the beta coronavirus genus. An outbreak of severe SARS virus coronavirus in 2003 in southern China from civet cats caused an eventual 8,098 confirmed cases, resulting in 774 deaths reported in 17 countries, with a fatality rate of 9.6%. In 2012, again another coronavirus, MERS coronavirus from dromedary camels caused an outbreak in Saudi Arabia, infected 2,494 cases, resulting in 858 deaths with a fatality rate of 36%. SARS coronavirus 2 emerged in November 2019 in China from bats, still under investigation whether it is from bats or any other animals. The genome is 96.2% identical to bat coronavirus, RATG13. It has not yet been determined whether the virus is transmitted directly from the bats or through an unknown intermediate host. Okay, this is old data are saying it is like that, but every time the investigations are under still process. So you can see here SARS, MERS, COVID-19, and this is the animals they are saying like it is transmitted. So the structure of coronavirus, it looks like a tennis ball. You can see here with all these spikes sticking out of it. Depending on the type of spike, it allows that virus to attach to certain places. Because of these spikes, the virus can attach to these surfaces easily. So the structure of coronavirus, it is having spike, S protein will be there, and envelope protein E, RNA is there, membrane glycoprotein, okay, nucleocapsid protein, and this is the structure of this coronavirus. It is a family of enveloped. This is just if you need more detail about this coronavirus structure and all these things, especially for the nursing students who are studying regarding this virus for their exam purpose, it will be helpful for them also. So coronavirus are a family of enveloped positive sense single-stranded RNA virus. It is RNA virus. SARS-CoV-19 2 virion is approximately 125 nanometer in diameter is there, and its genome ranges from 26 to 32 kb, the largest of all RNA virus. So it is an largest RNA virus. It has a 4 structural protein that I have shown in the picture. There will be spike, yes, and that is structural proteins. Envelope, that is E, membrane, that is M, and nucleocapsid, that is N, SEMN. So S, E and M protein create the viral envelope. N protein forms a complex with RNA, that is nucleocapsid, and aids in the regulation of viral RNA synthesis. M protein projects on the external surface of the envelope, spans the envelope 3 times. Okay, this is S and this is envelope protein, and this is RNA and membrane glycoprotein and nucleocapsid. Okay, so M protein project on the external surface of the envelope, spans the envelope 3 times, and it is important in viral assembly. E protein has an unclear function, although it may aid in viral release. S protein is a club-shaped surface projection, giving the virus its characteristic crown-like appearance on electron microscopy. It is responsible for receptor binding and fusion with the host cell membrane. So M protein, E protein and S protein, viral envelope and RNA and protein. This is the structure. Okay. Now we can move through the mode of transmission. Coronavirus are zoonotic, transmitted to humans through animals. It is hypothesized that horseshoe bats are the natural reservoir of SARS coronavirus 2. Since the virus genome is 96.2% identical to that of a bat coronavirus. At this time, the intermediate host is still unknown, maybe a pangolin that we already discussed before. So in humans, the virus is transmitted when respiratory droplets from coughing, sneezing, or talking of infected individuals come into direct contact with the mucous membranes of another individual, including the eyes, nose, or mouth. In the air, larger droplets tend to drop towards the ground within 1 meter, that is 3 feet, of the infected person, while smaller droplets can travel over 2 meters, 6 feet, and remain viable in the air for up to 3 hours under certain conditions. Other forms of transmission include the following: direct transmission through hand-to-face contact from infected surfaces. Fecal-oral transmission is also believed to occur. SARS coronavirus 2 RNA has been detected in stool specimens, but fecal-oral transmission has not been clinically described. Vertical transmission, mother to child, has not been reported. COVID-19 is not considered to be airborne, as coughing, sneezing, and talking do not generate droplets small enough to behave as aerosols. However, certain medical procedures can generate virus-laden aerosol clouds, which put healthcare personnel at a higher risk of becoming infected. So, how COVID-19 is transmitted? Respiratory droplets. So, it seems the virus is primarily spread by droplets. When the person coughs, sneezes, already we discussed this matter. Therefore, when a person who is infected COVID-19 coughs or sneezes, these respiratory droplets contain the virus. So, water droplets act as a vehicle for the virus to spread to the respiratory system of others, especially if the person is in close contact with the others. You can see here inside this water as a vehicle, there is the droplets coronavirus carrying. Next is contact transmission. When a person who is infected with COVID-19 coughs, sneezes, etc., the water droplets that contain the virus can fall onto the surrounding surface or object. It is unknown how long the virus lives on surface at this time. If a person who is not infected with COVID-19 touches the contaminated object's surfaces and then touches their eyes, nose or mouth, they could infect themselves with the virus. That is contact transmission. Then the other one is fecal oral transmission. It is suspected that the virus may be shed in an infected person's stool, which can lead to the transmission route of fecal oral. This is still to be determined at this time. Next, our topic is what is the incubation period of COVID-19? Incubation period is when a person first starts showing signs and symptoms from the time of exposure. According to the CDC, they state the incubation period seems to be minimum of 2 days to up to 14 days. 2 to 14 days, according to CDC. This is why people are being quarantined for 2 weeks when they are suspected of having COVID-19. This is because this tends to be the time period when people start showing signs and symptoms. However, recent reports from Chinese provincial government states it could be as long as 27 days. Time between infection and the onset of clinical symptoms of disease, that is incubation period. As per WHO, it is 2 to 14 days. As per the CDC, it is 2 to 14 days is the incubation period of COVID-19. Now, we can see the symptoms. Symptoms of COVID-19: cough, fever, chills, muscle pain, shortness of breath or difficulty of breathing, sore throat, new loss of taste or smell. So, among 80%, it will be mild infection. And if remaining 20%, it is severe infections. We can see COVID-19 signs and symptoms, how it is affecting each system. So, there will be headache. In the respiratory system, mainly it is affecting, that is coughing, sneezing, runny nose, shortness of breath, breathing difficulties and sore throat will be there. And in severe cases, there will be pneumonia, severe acute respiratory syndrome, lungs inflammation and congestion will be there. In the excretory system, decreased kidney functions, kidney failure in severe cases. Circulatory system, decreased white blood cells, so the TLC count will be decreased. In severe cases, cardiovascular damage. In the digestive system, diarrhea, and the systemic circulation, fever and fatigue. These are the COVID-19 signs and symptoms. It depends on the people. Okay, so most infected people will develop mild to moderate illness and recover without hospitalization. Most common symptoms like fever, dry cough, tiredness. Less common symptoms: aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin or discoloration of fingers or toes. These are the less common symptoms. Serious symptoms are difficulty of breathing or shortness of breath, chest pain or pressure, loss of speech or movement. Seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or a health facility. So people with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. So if you are feeling any mild symptoms also, maybe your family members will get affected fast if they are prone to get this COVID-19 and the old age people and also you should quarantine yourself. Asymptomatic cases are more. Okay, these individuals can transmit the virus. They represent more than 50% of all infections. They do not develop any noticeable symptoms. Anosmia, hyposmia and dysgeusia have been reported in many laboratory confirmed cases of patients who were otherwise asymptomatic. These individuals can present radiological and laboratory findings characteristically found in symptomatic COVID-19 patients. COVID-19 highly contagious. Why? Because production of high viral loads, efficient and prolonged shedding of virions from the upper respiratory tract, Asymptomatic individuals are also infectious, posing a significant challenge for contagious prevention. So SARS coronavirus 2 can remain infectious on surface outside of a host from a few hours to a few days. Due to these reasons, COVID-19 is highly contagious. So persistence of coronavirus on surface, we can say. In copper, the coronavirus persistence is 4 hours. Cardboards, 24 hours. Plastic and stainless steel, 2 to 3 days. In the air, 3 hours. So here large droplets are dropped to the ground within 1 meter. So large droplets are coming down to the ground within 1 meter, that is 3 feet. And small droplets travel up to 2 meters, 6 feet. Risk factors for COVID-19. Who all are risk for COVID-19? Anyone, that is, anyone can affect this coronavirus, but the risk factors will be there. We can say those who are having chronic disease, any chronic lung disease or moderate to severe asthma, cardiovascular disease, immunosuppression for long-term steroid use, any cancer patients, AIDS, HIV infections, any congenital immunodeficiency syndromes, and organ transplants, immunosuppressants, taking and this immunosuppression also will cause, there is a risk factor. And severe obesity, BMI more than 30. Then diabetes mellitus, chronic kidney disease, undergoing dialysis patients, cerebrovascular disease, sickle cell disease and liver disease, age more than 65 years, living in a nursing home or long-term care facility. Children are at a lower risk of developing severe or critical infections and complications appear to be milder. Pregnancy, risk of infection is the same as in non-pregnant individuals. Higher risk of a severe illness in pregnant individuals is assumed due to behavior of similar respiratory infections such as SARS and influenza. So, what is the pathogenesis of COVID-19? So, SARS coronavirus, infection of a tracheobronchial tree, infection of the immune system, immune cells, then interferon and cytokine response, which will cause severe lung injury. So, here the detailed pathogenesis, if we are explaining, there are some steps. Virus entry and spread will be there, and we can see the pathological findings. Then acute respiratory distress syndrome will be there. Then cytokine storm formations response will be there, and finally immune dysfunction will be there. So cytokine storms, you can see majority of severe cases and death from COVID-19 result from a runaway inflammatory response within the patient's own immune system, causing a cytokine storm that is difficult to interpret. So normal immune response triggered, you can see here. So macrophages and dendrite cells release cytokine signals. So what will happen here? Inflammatory reaction, lymphocyte will be there. Then it destroys the invading coronavirus cells trying to destroy it. Then inflammatory markers will be there. Then lymphocyte damaged while trying to destroy the coronavirus. So fighting with the coronavirus, this lymphocyte will get damaged. Damaged lymphocytes release ever more cytokines. Again, the damaged lymphocyte is releasing more cytokines. So immune response cycle out of control then. So what will happen here? Inflammatory reaction continues to increase, and finally inflammatory response begins to destroy healthy cells, leading to acute lung damage. So stages of infection: stage 1, asymptomatic stage, initial 1 to 2 days of infection. The inhaled virus likely binds to epithelial cells in the nasal cavity and starts replicating. So initial 2 days asymptomatic stage, it is initially binds with the epithelial cells in the nasal cavity and it is starting for the replication. Then ACE2 is the main receptor of both SARS coronavirus 2 and SARS coronavirus. ACE2 is broadly expressed in nasal mucosa, bronchus, lungs, heart, esophagus, kidney, then stomach, bladder and ileum, and these human organs are all vulnerable to SARS coronavirus 2. In vitro data with the SARS-CoV indicate that the ciliated cells are primary cells infected in the conducting airways. There is local propagation of the virus but a limited innate immune response. At this stage, the virus can be detected by nasal swabs. Although the viral burden may be low, these individuals are infectious. The RT-PCR value for the viral RNA might be useful to predict the viral load and the subsequent infectivity and the clinical course. That's why we are doing RT-PCR. Stage 2, that is initial 1 to 2 days in the epithelial cells of the nasal cavity, and it starts to replicate to other organs. Stage 2, upper airway conducting airway response. So here the virus propagates and migrates down the respiratory tract along the conducting airways, and more robust innate immune response is triggered. Again, this nasal swabs or sputum should yield the virus as well as early markers of the innate immune response. So in this time, this COVID-19 is clinically manifest. The level of CXCL10 or some other innate response cytokine. This is cytokine response markers, may be predictive of subsequent clinical course. So that is not that much important. So initial stage it will be 1 to 2 days in the nasal mucosa and all. Then it will be replication there. And stage 2 it is reaching to the upper airway and conducting airway response. In this stage we can see some of the symptoms of this this coronavirus infection. In stage 3 there will be hypoxia, ground glass infiltrates, and a progression to acute respiratory distress syndrome in stage 3. So what are the testing for COVID-19? The real-time PCR test will assess and detect the genetic material of the COVID-19 virus. So there we are taking the swab and the lysis buffer is doing RT-PCR mission, it is keeping. So real-time PCR test. So COVID-19 PCR we are calling it as. So can detect a small amount of viral RNA, not very sensitive. Then other tests like a chest CT we can do to detect a viral pneumonia. Isothermal amplification viral RNA. Rapid serological testing, serology also there, blood test also there. Can detect a previous infection is there or not. Look for other causes like a quick flu test, respiratory viral panel, all these things. So testing of how the swabs are collecting. One method is nasopharyngeal swab collection. Okay, the other posterior pharyngeal wall, the oropharyngeal swab also taking. Specimens used for testing include the following: nasopharyngeal or oropharyngeal swab. Nasopharyngeal is the first choice. Oropharyngeal swabs are acceptable only if nasopharyngeal swabs are not available. Nasal mid-turbinate swab or swab anterior naves. Nasopharyngeal wash aspirate or nasal wash aspirate specimen we can use. Sputum for patients with a productive cough inducing is not recommended. Bronchoalveolar lavage, then tracheal aspirate, pleural fluid, and lung biopsy for patients with critical infections receiving invasive mechanical ventilation. These are the specimens we can using for COVID-19 PCR. RT-PCR testing can be negative initially. If suspicion of COVID-19 remains, patients should be retested every 2 to 3 days. In severe cases, swabs from upper respiratory tract may be negative, while specimens from the lower respiratory tract are positive. RT-PCR test can be also yield false negative 20 to 30% of the cases also. Other investigations for COVID-19. Other investigations of COVID-19, patients with COVID-19, we can do this WBC count, white blood cell count, leukopenia, leukocytosis, and lymphopenia is the most common thing. And inflammatory markers, there will be increased LDH, and ferritin level also will be increased here. Liver markers, increased AST and ALT will be increased. Chest X-ray. Not recommended for the initial evaluation, reserved for hospitalized patients or symptomatic patients with a specific clinical indication. We can do chest X-ray and CT. Common findings include ground glass opacities, multiple areas of consolidation, crazy paving appearance, ground glass opacities will be there, and bronchovascular thickening will be there. Lesions usually have a bilateral, peripheral, and lower lobe distributions will be there. Now we can see most important section, that is prevention of COVID-19. As we know that wear a face mask, wash your hands, social distancing, 6 feet distancing, and stay at home. So we can see what are the preventive measures and education we can give to the patient. Inform them hand washing frequently, soap and water for at least 20 seconds or alcohol-based sanitizer, use of that. Don't touch the mouth, nose or eyes with hands. This helps decrease the risk of transferring the virus into your respiratory tract. Cover your coughing and sneezing and then wash hands afterwards. Always properly dispose of tissue paper that may be used to cover, sneeze and cough. Wear a face mask. Like update April 3, 2020, it was now recommended that a cloth face mask may be used by the general public when going out in public. However, medical masks should be reserved for healthcare professionals at this time, like a 95 and all for the healthcare professionals, and other normal surgical face mask can be, and cloth face mask can be used for the public. Avoid close contact with people who are sick, fever and cough. Stay informed and visit ready government pandemic for how you can prepare your family. Avoid travel to high-risk areas. If you have traveled and feel sick, notify the doctor immediately. Stay home if you are sick. Cook meat properly from animals. If patient is showing signs and symptoms, immediately ask about the travel history. Know and follow your hospital plan for COVID-19. Protocols are being developed and are in place. Isolation precautions, how to wear the PPI, how we are doing the COVID-19 testing. Based on your hospitals, you should have the awareness about these things, and how to disinfect the surfaces. Treatment for COVID-19, there is no vaccine currently available. Flu vaccine does not work for COVID-19. No specific treatment other than treating the signs and symptoms, antiviral, respiratory support and supportive care we can give for COVID-19. Health worker rights include that the employees and managers in health facilities assume overall responsibility to ensure that all necessary preventive and protective measures are taken to minimize occupational safety and health risk. So the management should provide all the materials, PPI to the employers who are contacting with this COVID-19 patients care. Provide information, instruction and training on occupational safety and health, including refresher training on infection prevention and control, use putting on, taking off, disposal of personal protective equipment, all these things. Provide adequate IPC and PPE supplies like mask, gloves, goggles, gowns, hand sanitizer, soap and water, cleaning supplies in sufficient quantity to healthcare or other staff caring for suspected or confirmed COVID-19 patients, such as workers do not incur expenses for occupational safety and health requirement. So familiarize the personnel with the technical updates on COVID-19 and provide appropriate tools to assess, triage, test and treat patients. Provide a blame-free environment for workers to report on incidents such as exposure to blood spill, body fluid spill from the respiratory system, or to a case of violence, and to adopt measures for immediate follow-up. So not only the nurses, all other healthcare professionals should follow all these measures, wear the PPI and teach the housekeeping staff and other staffs how to wear the PPI and how to remove the PPI properly, all these things. Those who are in contact with COVID-19, so to avoid the spread of infection, okay? Health worker rights include that employees and managers in healthcare facilities, they should maintain appropriate working hours with breaks, consult with the health workers on occupational safety and the health aspect of their work, and not be required to return to work situation when there is a continuing or serious danger to life or health until the employer has taken any necessary remedial action. Allow workers to exercise the right to remove themselves from a work situation that they have reasonable justification to believe presents an imminent and serious danger to their life or health. Each employer, this process it will be different according to their workplace situations. The main thing, the management should provide the enough supplies of the PPIs and COVID testing, all those things, all the staff's COVID testing, all these details, and even self-monitoring of signs and symptoms, and self-isolate or report the illness to the manager if you have anything. All these things, okay, and disposal of this waste, all these things are the preventive measures we can use in healthcare settings. I hope you enjoyed today's section. So next section will be available regarding the COVID-19 nursing care and COVID-19 critical care management, COVID-19 and pregnancy. These three topics also. I hope you enjoyed today's section. Thank you.
Nursing Manthra website provides you information about nursing news related to licensing procedures to different countries. Study materials for different exams like DHA, HAAD, MOH and other prometric exams. Various job informations in the medical field. Free PPT presentations and notes for the nursing students as well as the lectures. DATAFLOW and licensing verification services to all countries. Free crash course videos for different nursing exams in Nursing Manthra YouTube channel. Current news in the nursing field. I am inviting everyone to the Nursing Manthra family. Please subscribe and join Nursing Manthra to avail more updates. Thank you.